My name is Odo Honora. I am a physician and I'm the one leading the Rural Primary Health Improvement Program in Nigeria. A child dies every 2 minutes from malaria-related complication in Africa. Nigeria contributing about 27% of the global malaria deaths in the last decades. This program is a global health initiative program, and it started in the year 2019 in rural community in Nigeria as a malaria control program, which transitions to a comprehensive primary health program. It started as a program titled Say No to Malaria. The program was inaugurated in October 2019.
You are welcome to Amechu and the community where we stand to say no to malaria.
Malaria is a global public health disease with high morbidity and mortality rate. It is endemic in Nigeria.
We focus on the population that are most vulnerable to malaria, which are the children aged less than 5 years and pregnant women. The chemophilaxis method we use is based on the recommendation of the WHO, and it's called intermittent preventive therapy, and this is used in pregnant women and has been confirmed to be effective in preventing adverse outcome from malaria. We use the same medication on children less than 5 years, and we give it to children, eligible children, and age-appropriate dose every 3 months, and this is being administered by the trained community youths. During the visit, the parents are also given adequate education about malaria and provided with dose of acetaminophen to have at home and give to any of their child that develops fever, since fever is a common symptom of malaria. For the first 12 months, we are able to have 4 home visits. We collated the results because we had a survey at the end of the 12 months, and the outcome based on the survey was satisfactory. Based on the finding, there was 54% reduction on the incidence of malaria on participants of the program. There was 0 severe malaria, there was 0 deaths. And 100% of the participants reported increase in knowledge of malaria and want the program to continue. The parents are also counseled to take any of their child that they think has malaria to our treatment center, where diagnostic test is conducted, and if the child has malaria confirmed by the test, the child is started on appropriate therapeutic dose of malaria, and the remaining dose are given to parents to continue the treatment at home and bring the child back to the clinic if the child is still sick. The findings on the first phase leads to expansion of the program and the transition to a comprehensive primary care program, which in addition to malaria control involves treatment of other chronic medical conditions, including hypertension, diabetes, and also building a physical primary care clinic where community members can visit as needed, and also establishment of a charity organization.
health should actually be for all. No restriction, no races, no boundary, no color difference. So it's something that everybody should be able to access. And the good thing about it is for those ones who could not do that, bosses can be able to provide that. Listen to them. Do that services they should have been able to get elsewhere. And not only that, provide the medication they should be able to receive. People are health seeking, so it makes attending to them very easy, and they are always willing to learn new things. So, giving my own contribution is like giving back to people who will always, if not, whether they remember it or not, trying to help, put life and put smart to other youths. It's something I'm so passionate about.
The primary care clinic opens on weekdays, and there is doctor, a nurse, a lab technician, and other support workers that are available in the clinic to provide care to the community. Another aspect of the program is outreach, visiting other communities, providing cares to the communities.
My name is Ifeyinwadi. I am a health educator, and I'm also one of the team leads of Oasis Community Health Foundation. Apart from providing free quality health care services, Oasis Community Health Foundation also provides and disseminates information, high quality health information, to help the people change their attitude and their lifestyle in order for them to achieve optimal health. The highlight of our health education program is when you see that eureka moment on the faces of people.
It's important to note that all the services provided through this program is free to participants. The expansion of the scope also involves school health program. The members of the team visit schools. The scope also involves eye care. Optometrists were recruited to be part of the program, and it's important to mention that there have been a lot of concern from the findings through the services of the optometrists because of the high incidence of increased intraocular hypertension and glaucoma diagnosed on the general public through this program. Another component of the program is a dental care. So we have a dentist that provides free dental care during the outreach, and this has been confirmed to be very effective and beneficial to the community as well. And also oral health program. So children are being provided education on how to better care for their teeth. Also provided medication to prevent worm. And deworming is a recommendation by the WHO. The Rural Primary Health Improvement Program in Nigeria is a global health program with strong collaboration between rural community and international organizations, and have proven to be very useful in saving life and improving the hope of people living in rural communities in Nigeria.
We are not going to stop. We are going to continue